I want to first talk about under eye bags because this is such a popular question that I get from my patients. I know a lot of other doctors get it too. First of all, why do some people get really bad under eye bags and how come some people don't?
For the most part, it's an age-related change, but it does the hereditary factors play a major role with this. And so, especially when you have someone who has had lower eye bags to some extent, even since their younger days, often we'll see that gradually this starts to increase with time, really in anyone. But if someone's had it at a younger age, we'll sometimes see that they start to develop a worsening maybe earlier than they might expect. And a lot of that is definitely driven by, from a hereditary standpoint, having those changes at an earlier age and then starting to see, further development of lower lid bags over time. And so really what's happening there is it's the lower lid structure. So, the bags can be a combination of different things. What we're often seeing is a prominence of the lower lid fat pads, and these are the fat pads that are normally there from youth. But let's say even if you don't have this prominence in your younger days, it can develop over time. So the fat that is in that space basically is there to cushion and protect the eye. And it's not that we develop more fat over time, it's just that it expands into the space that it's given. And the reason for that is because the overlying structures like the skin, the muscle layer, and this third layer that is immediately in front of the fat, what we call a connective tissue layer, basically they all start to loosen with time. Fat expands to fill the space available.
And is there anything that we can do to prevent this? Because we're all going to age, obviously. So, is there anything that you can do to sort of prevent this sort of natural process from happening?
The answer is on the skin side, yes. So sometimes, the fat prominence can get worse because the quality of the skin worsens with time. Again, some of that is based on hereditary factors. The genetics we can't totally control, but things we can control are how well we take care of our skin and how well we keep it hydrated, right? So part of it is sun protection, and so this is true in general for our face and any skin that's exposed to sunlight. And it's not so much just like when we're planning to be outdoors, quote unquote. It's really like at any time, even right now, as I'm sitting in my office speaking with you, there's ultraviolet rays coming through the window, right? So we're constantly bombarded with UV. So it's important to wear sunscreen every day. And there's even sunscreen, like certain types that you can apply to your lower eyelid, like certain products that have SPF in them. But one of the key things is actually having sunglasses with good sun protection, ultraviolet protection when you're outdoors. And that does play a role as far as minimizing the amount of change that we get from UV exposure over time for our lower and upper eyelids. And then the other thing is hydration and good skincare. So literally, drinking plenty of water, staying hydrated, and then using products that are both hydrating as well as ones that help build collagen and elastin to maintain the firmness and tone of the lower eyelid skin can actually help to minimize the amount of bag formation that occurs over time.
Okay, that's really helpful, especially when it comes to prevention. Now, of course, sometimes when people are talking about this, they've already started to experience this. So prevention has kind of become a little obsolete for them. When someone already has eye bags to begin with, what can they do before opting into surgery?
It has to do with a combination of factors. Yeah. So we often approach it from sort of a multifactorial standpoint. So one of the things is, of course, going back to, as I was saying, making sure that there's good skincare. If there's opportunities for improving that, I think certainly adding to a skincare regimen for lower eyelid and maintaining, the health of the facial skin in general is good. The second thing that we can do is look at the adjacent spaces and structures. And what I mean by that is, in the lower eyelid, the adjacent area before, as we go down, before we get to the cheek, in this lid cheek junction is what we call the tear trough area or the nasojugal fold. And right in that area, there's often a depression, right? So the way I explain it to patients is if you have an elevation or prominence of the lower lid from the fat pads or loose skin, think of like an elevated hill next to a depression or a valley. So when the hill is next to the valley, it makes the hill look larger than it really is, and it can make the valley look deeper than it actually is, right? So there's some optical component to it where if we can actually bring that valley up, and the best way to do this is often by using like a hyaluronic acid based dermal filler gel that can be injected into that space. Now, I will just add the caveat that not everyone is a candidate for that. It's something that we have to look at the consistency of the skin, the thickness, the amount of extra skin that's there, the amount of the adjacent fat pad that's there, because we can get to the point where if the fat pad's really prominent and we're trying to really try and masquerade that area with more filler, it can just make the whole thing look worse. So there are ways of strategically masquerading that area, just doing a really good job with skincare. And then the other thing is selective use of neuromodulators like Botox, which I know we're going to talk about in a little bit, can also be used as a way of adjunctively reducing the amount of wrinkle formation that happens in the lower lids, particularly with expression.
So how does Botox work to help the bag specifically?
Yeah, so think of more on the skin surface. So, when we smile, there, the facial expression, it tends to create this roll of muscle in the lower eyelid. So we have a muscle that goes all the way around our eyes in the upper and lower lid that's called the orbicularis that's responsible for blink, but also like the tone of the lower eyelid and the position of the lid against the eye. It helps maintain all of that. So we have to be careful about how we inject Botox, but there is a way to put just an absolute minimum number of units in the lower eyelid spread out that when we smile, the amount of roll formation that happens with that muscle is minimized. So it helps the lid kind of stay flatter and tighter in a way, and reduces the appearance of the lower lid bag when there's one
Okay.
present.
Okay, that makes sense. So now getting into surgery, which I know is the more permanent solution for this. Talk to me about who would be a good candidate for a lower lid blepharoplasty.
Yeah, so lower lid blepharoplasty is a surgery that we can perform really on, there's no age restriction, right? So in a sense that, just depending upon sort of the motivating factors of the patient and if they have realistic expectations of what can be achieved depending upon skin quality, things like that. And if they're healthy enough, to undergo either an in-office procedure or at a surgery center with sedation anesthesia. And so that's kind of the different settings and methods in which the surgery can be done. In general, what we look for is prominence of the lower lid fat pads with or without overlying looseness or laxity of the skin. And sometimes there can be some laxity or looseness of this corner tendon of the eye, what we call the lateral canthal tendon, which can be stabilized at the same time. And so, really, I find this is a very customized approach. There's that should be taken in both in terms of the evaluation, the recommendations that are made, but it's often a surgery that is planned in a way that we will contour the fat pad to some degree, possibly remove some skin, and often stabilize the lower lid with that corner suture that the stitch that I was describing to hold the lid, in tight contact with the eye. We can couple lower lid surgery, what we call blepharoplasty, with energy-based treatments like laser resurfacing, which I know we're going to talk a little bit more about in a bit. But that's something that can be done either adjunctively if we're doing it in the office, or we can do surgery first, like in a surgery center setting, if the patient prefers to be a little bit like on the sleepier side, monitored, with IV sedation, and then follow that up with a laser in the office to help with that skin tightening and collagen building.
And talk to me about the actual surgery itself. It's both eyes done at the same time. Can you get into the different elements of cost because we know it's not covered by insurance?
I do get that question. Can lower eyelid surgery ever be covered by insurance? The answer to that is if there's what we call a malposition of the lid, right? So, like if the lower lid, what I tell people is if the lower lid's turning out or turning in, and we've either lost protection of the eye or the lashes are scratching against the eye, then that's a totally different type of mechanism or issue with the lower eyelid that can get covered by insurance. But generally, if we're talking more about the aesthetics of the lower eyelid, improving the look, giving the eyes a more rested appearance, more youthful, then we're talking about things on the aesthetic side, of course.
I want to ask you about the cold spoon, putting the cold spoons under your eyes to make your bags go away. Why does that help? And how much can you expect to actually get out of that? I mean, is that like an hour? Or, and there's also something about like caffeine. Like, can you talk a little bit about that?
Basically, what you're getting is like a vasoconstrictive effect and some contraction of the tissue. So what cold bleed does is it contracts some of the looser tissue, like those layers that we were talking about. When we vasoconstrict, it reduces, the bulk of the muscle to some degree. It is really a pretty thin muscle we're talking about in that area. But just the combination effect, and then also with caffeine, what we're just getting is like a temporary relieving effect, as you said, of about an hour to two. There are some other, along those lines, there are some skincare products that are available just over the counter that can help with lower lid tightening temporarily, some of which have been, advertised on TV that actually work and are okay to use near the eye. Of course, just a temporary solution for something that may work better in the long term as a surgical approach.